Hi, I'm Professor Dr. Ashish Davalbhakta at Aesthetics Medispa and Advanced Aesthetics in Pune. In this educational video, I'm going to cover a commonly asked question: what is the recovery like and how long would it take to recover from a blepharoplasty? So let's say that your surgeon has recommended that you need a blepharoplasty, and then you have to plan your social schedule. So you need to know how the recovery goes and when can you resume your commitments. So basically, blepharoplasty recovery would depend upon whether you are having just an upper eyelid or a lower eyelid isolated surgery. Recovery is much quicker, much shorter if it is just the one pair of eyelids, that is either the upper or the lower. But I'm going to talk about, let's say that you're having 4-lid surgery, which is both the upper eyelids and both the lower eyelids. If you're having both 4-lid surgery, then you're going to have swelling for a lot longer, bruising, ecchymosis, or even chemosis, and things like these that would be there for a little longer. So first of all, stitches are removed in 7 days time. So there will be paper tapes around the stitches, so social commitment during that time would be difficult. Bruising, if there is any, would take 3 weeks to go. Swelling is quite a bit, and hence I don't think you would be able to have any social commitment, but it doesn't limit your activity. I mean, you can work from home, you would obviously be up and about, you would be able to do most of the things that you do on your own, and it doesn't limit you. You don't have to be bedridden. You should sleep slightly propped up so that the swelling resolves faster, and massage and other things. But once the stitches are removed in a week's time, then all you have to do is massage, put your eye drops, ointments, and just wait for the healing to complete. And that may take, especially the swelling, may take a minimum 6 to 8 weeks to go from the eyelid. And thinner the skin, the looser or more relaxed the skin tone, the more the swelling you will have. And eyelid margin looks swollen. Eyes may look a little puffy for that long. Usually by 6 to 8 weeks, around 80-85% of the swelling is gone. So social commitments wise, if you are going to face a camera or you are going to meet people, and you may want to have sunglasses or something to hide your eyes behind, if in case you have to. If you can't use those, then it would be better if you don't keep any social commitment of that kind for at least 2 months. And very rarely you may see a little longer recovery period, something like even up to 3 months sometimes. But by 6 to 8 weeks, most of the recovery has happened, and you should be able to resume your social activities. All the exercise and everything you can start by 6 weeks time. Your surgeon may recommend not doing any exercises where your head is dependent, because that would just add to the swelling from the gravity. So you have to avoid all of those things. And such gravitational changes in the swelling may continue for even 4 to 6 months. Like when you wake up in the morning, you may find your eyes are swollen. During the daytime, with gravity, the swelling dissipates, it goes down. End of the day, it's least. And again, next day morning, you may find that your eyes are swollen as you get up. And that's a change because the blood vessels haven't yet regained the tone, and they are leaky. So with gravity, they leak, they cause swelling, and it dissipates during the daytime. And that is a complaint that we often get. There's nothing much that you can do about it apart from massage, and you just have to put up with it in case you do have that. So that's by and large how the recovery is. And unless you have any complication like excessive drying of your eyes or ectropion or lag ophthalmos, I think the recovery is fairly smooth and follows this pattern. Thank you for watching this video.